is 2.5, is it? Okay, it's 0.5 mil here. Hello everyone, welcome back to my channel, my people. Motherhood they carry me go where I don't know. Help me, help me.
Help me! Help me! Help me! Help me! Help me! If they carry me, they go where I don't know. Help me!
So guys, welcome back to my channel. I've been away for a very long time, for 2 weeks now. I needed that break. So guys, in today's video, I'm going to do a detailed review on colic drug. Yeah, drug that is used to relieve your baby of colic pain. In case you don't know what colic pain is, I'm going to explain it in this video, and also how to soothe your baby to reduce the pains of colic, and also mention some drugs you can use for your baby who has colic pains. I mean, colic pain always happen to most babies, not just some babies, most babies. So if you are seeing this face for the first time, I'm Nelly's Corner. Welcome to my channel. Do me the favor by hitting that like button. Bam. Yeah. Colic pain has to do with that distress pain that always happens to babies, most babies, that make them wrinkle, that make them cry, that make them fussy. I'm listing out the symptoms of colic pain. So if you notice these signs, like you have fed your baby, no wet diaper, everything check on point, but your baby is still fussy, your baby is still crying, very uncomfortable. Probably your baby is going through colic pain. Colic pain is a type of pain that distresses your baby, that discomforts your baby, as if his or her intestines are contracting. Yeah, so you know contraction now, you have gone through contraction. So that is maybe a minimal rate of contraction. How do you relieve your child of this colic pain? You relieve that your child by laying him or her on her tummy and patting her gently. Once you lay your baby on his or her tummy, there's this comfort they get. The colic pain tends to relieve. They don't go out. They don't go immediately. They just relieve and allow the baby to sleep. Another thing you can do is by making sure you burp your baby after feeding, after breastfeeding. During the breastfeeding process, your baby tends to suck in air, so it's necessary to always burp. And some babies they take time before the burp, and that is where this drug comes in. Apart from this drug, there are other colic drugs that are in the market, like grip water and nospamine. I don't know whether I'm pronouncing it well. And this INFACOL. This INFACOL is what I've used for my 3 children. Believe me, these drugs they don't stop the colic pain. They just relieve for a while, not for a long time, but for a while. So going into the review of this INFACOL, the main thing this INFACOL does is that it helps your baby release wind. It helps your baby to release gas, either by belching or by farting. Yeah. So this INFACOL is not going to stop the colic pain. I don't think anything stops it. They just outgrow it. So this INFACOL simply relieves it. So I'm going to tell you guys some of the benefits of INFACOL and what they claim to do to your baby. So the first one here is that it relieves infant colic and gripping pain. Yeah, relieves and not stop. The next one is it helps to release wind. Yes, like I said, it helps your baby to gas or release gas either by belching or by farting, any which way. Because when the gas is trapped in the intestines, it helps to increase the colic pain. Not as if the gas causes the colic pain, but it helps to increase the colic pain. Then this Infacol has an orange flavor. For you, if your child is the type that doesn't like taking drug, this drug has an orange flavor, in as much as it is not orange in color. I'm going to show you guys in a while what the color looks like. Then it's suitable from birth. Yes, you can use this Enfacol from birth. Remember, these colic pains come in from newborn. till about 3 to 4 months, so you can use it from birth. Then it's convenient to use. Look at what the container looks like. It's convenient to use and has a dropper. You don't need to measure this type in a small cup. You just measure it with the dropper. So when it comes to how to use it, from the directions, they said you should always drop it in your baby's mouth before breastfeeding. One dropper is enough, but as time goes on, you can increase it to 2 or 3 droppers. So you just take it out, release all the contents first, and now suck in the dropper, put in the dropper, and you get a full dosage. It's 2.5, is it? Okay, it's 0.5 mil here. I'm not too sure. Then you now put it in your baby's mouth. So trust me, once you drop this in your baby's mouth, between 30 minutes or 20 minutes down the feeding, your baby will belch. So if your baby is having difficulty in belching, or in farting, or has a very serious colic gripping pain, try INFACOL. Okay, I tried this for my first and tried it for my second, and this third one I'm using it, but as the price keeps increasing. When I used it for my first baby, it was around 2.5. Second baby, 3,000 or 3.5. But now the price of this Infaco is 4,500 naira. Maybe in the next 2 years or 3 years, it might be 3,000, 6,500 naira. Who knows? So have you used Infaco before? Do you have a positive or negative effect of this drug? Drop into the comment section. So if your baby is having a very bad colic pain, cannot sleep at night, is very fussy, cries a lot, try this Infacol. Okay, it's not a paid advert, but it is a detailed review. It might work for you, it might not work for you. I mean, Anija Fufa Nishi. Motherhood is not a joke, okay? So anything that will save you the stress, the pain, the frustration, I would always advise on this channel you should give it a try. So having said that, I'm going to draw the curtains here. If you have not joined the family, please do well. Click on the red subscribe button, hit the like button, share this video. I'll see you guys in my next video. So for now, bye bye. Love you.